Every single day in your practice, it is a series of small critical moments. So a patient hands you a new insurance card, a provider needs to get a prior auth that's still pending, a chart from yesterday is still open. And when these small moments are missed, they don't stay small. So they eventually snowball, right, into chaos and denied claims, upset patients, maybe even physicians or providers standing around waiting, and a billing team that's constantly playing catch up, which leads to increasing AR. So we've talked about the power of a daily huddle before, and today we're going to really get tactical into what a daily huddle could look like. And I'm bringing this from years of actually just managing hospital laboratories and how we use huddles and huddle cards and all of that to help support daily operations in your practice. So we are going to reframe the huddle, not as a meeting, but kind of as a checklist, right? A simple checklist that ensures your practice is ready for smooth, profitable day every single day, even before that first patient walks in the door. So if you've been managing a practice that feels chaotic at times, maybe you start your day without a plan and you're starting your day in chaos and it just kind of continues into this chaotic day, you may be feeling like you're being reactive, not proactive. And so today we're going to really focus on a routine that you can implement within your practice. You can model what it looks like and then delegate that to somebody else, obviously an office manager or a lead, depending on the department or the size of your facility. So today we're going to talk about patient eligibility, right? Obviously, we've talked about this before. And if it isn't checked properly, you're obviously going to result in denied claims, worked AR that has to be done more than it would have had you just checked eligibility ahead of time. We're going to talk about prior auths that if they're not secured before a procedure, right, obviously your time's wasted and either a patient may be rescheduled or alternatively you will have completed the schedule for free. We're going to talk about outstanding balances, making sure that those are flagged because again, if you miss an opportunity to collect, then you're sending patient statements, maybe multiple patient statements, maybe a collection agency, and either losing out completely on that balance or alternatively having to pay additional costs in order to collect what was already due to you. We'll talk a little bit about chart closure and how obviously the longer it takes for you to close a chart, the longer it takes for you to get cash in your bank, and then that cash flow snowballs downhill. So while each of these are small and realize that, you know, doing one or two of these is better than none, in an ideal world, you're setting up a system so that there is success in every single one of these steps every single time. And we're going to talk about how even a quick huddle, whether that's, 15 minutes in the morning with each of the different departments or all together if it's a small enough team, we're going to talk about the huddle that needs to happen every single day in order for your office to succeed, have the cash flow it deserves, et cetera. So this huddle is fast, it's focused, again, 15 minutes every morning. And again, a lot of our labs that I am a part of from a leadership perspective do this, hospitals do this. This is not a new thing for healthcare. And I really think having this within your practice, even if it's a small practice, is extremely helpful and will help your practice be more successful. So again, we're going to talk about an 8-point agenda. Again, this is supposed to be very, very quick, right? 1 to 2 minutes each, and move on to the next. So the first one is going to be eligibility, right? Who on today's schedule is a financial risk? Whose eligibility hasn't been cleared yet? How do you have this flagged in your system? Your front desk should be able to answer these questions. And they're looking for new patients, patients with new insurance cards, anyone with a high deductible, anybody with failed eligibility that hasn't been resolved yet. Hopefully you've tried to resolve those ahead of time, right? You've gone to payer portals, you've called insurance directly, you've contacted the patient. Really all of those things have been done before, but that, thinking about this huddle moment, right? It's okay, so we've got 60 patients today scheduled. Who are the 5 or 6 patients that we need to flag to make sure? And how are you communicating that to everybody in the front desk, right? Whoever did the eligibility, how are we flagging that for every single patient that gets checked in, right? So whether that's a note in the EMR, a billing note, a flag that you have highlighted sitting on the desk for the person who's checking in patients. If it's multiple people, obviously whatever you can do to have it in the practice management system is going to be best. But again, it's who is your financial risk? How is that being communicated? And how are you going to resolve that before the patient is seen. Number 2, prior auths. So obviously, this is obviously really critical. So say you have a schedule for upcoming procedures. The question is, do we have a green light on every single one of these? If an auth is pending, who owns it? What is your tracking system for managing prior auths? And so if you don't have a tracking system, I highly recommend getting one, whether that's a SharePoint, Excel document, something that's probably outside of the practice management software, because obviously if you are in the practice management software, you are only in one patient at a time versus looking at a full list of surgeries, the dates that they're scheduled, the prior auth status, the prior auth update, and then who's responsible, right? So in every single one of these tedious things, you've got to have an idea of what is the process we're going to take into place, who's tracking to this process, how are we flagging status of this task, right? Is it complete? Is it pending? Is there a challenge or barrier? And then who's responsible for that? Obviously, in a larger practice, you may have multiple people who are juggling these things. And so really defining, okay, this is the process that we're going to follow. We're going to have, this specific staff member run eligibility Monday, Wednesday, Friday, and a different staff member running eligibility Thursday, Friday, or Monday, Tuesday, Wednesday, and then someone else doing it Thursday, Friday. Whatever it is, you've got to have that written out, communicated, and then tracked. So for this prior auth, having that tracking system to list your patients, list the surgery dates, list the status of the prior auth, and then list next steps and then who's responsible. And I highly recommend filtering these or having a filter on these so you can filter them by complete. Another trick for these is to actually use the Excel function where you can say that only certain words are allowed within that column. So for example, if you're doing a status of prior auth, the statuses could be not started, not needed, complete, pending, right? And those 4 things are it. That way, when you filter, you're not having to filter a whole bunch of different comments that are in the wrong column. So again, key here is tracking mechanism. That daily huddle process is really just looking at that tracking, going, okay, do we have procedures this week that we still don't have prior auths for? Who's in charge of that? Are we getting those resolved today? Obviously, no procedure is going to happen without that green light. So again, quick check, prior auths, are on track for completion of surgeries this week or this day. Hopefully you're looking a few days ahead in terms of prior auths because obviously those take time to get. All right, tip number 3, patient collections. So again, similar to tip number 1, where you're looking at eligibilities, this should be that quick huddle where we've assigned or identified through the eligibility process which patients owe copays, have deductibles. Basically, do we have the amount figured out for each one of these patients when they come in? That way you're not scrambling and have a long checkout line trying to figure out how much they owe. You have it figured out ahead of time. You've written the amount in there. You understand if they have a balance, and that's all within your PM software. So the huddle tip here is to say, hey, do we have any questions? Or is there any patient that we don't know what we're going to charge them today? Is there any patient that we need to clarify how we're going to handle a large outstanding balance? And who's going to be responsible for having these conversations with the patients and check-in? Are there any questions about this process? Are there any questions about how to describe to a patient, hey, how would you like to pay today? Not, are you going to pay today? How would you like to pay today? In an ideal world, you're having this conversation when patients are being scheduled, right? You're letting them, hey, just to let you know, we check for copays and deductibles, and that you have to pay those prior to being seen, along with any outstanding balances. You can also make sure that they've read and understand the financial responsibility documents that you've provided to them. Obviously, make sure that those are all signed and completed prior to seeing a physician for the day. So really, really important to have this done. All right, huddle point number 4, open charts. Quick status check. How many charts from yesterday are still open? Obviously, the goal should be 0, if not 0. Who are those individuals? Who's following up with them to ensure they are closed by noon or end of day, right? If you're giving folks 2 days. And again, the more you focus on these things, the more people are going to go, oh yeah, I have to get my chart signed out because at huddle tomorrow, I don't want to be called out. And again, you're called out in front of your peers. You're called out in front of everybody in the office. and it's like, oh, I don't want to be that person. So again, really, really easy thing to implement. Point number 5, no-shows and cancellations. So obviously this is a quick recap of, have we had any cancellations? Do we have any no-shows from the day before? Have we charged those no-show fees? And for any cancellations today, how are we filling those, right? Do we have a wait list? Can we move up an afternoon appointment? Obviously, an empty slot is going to be lost revenue. And so having a wait list or having appointments where, say, those are, filtered for somebody wants an earlier one if they can get one. And so keeping a list of those patients to say, hey, we're going to call. Obviously, there are ways to automate this. Highly, highly recommend automation, especially for larger practices. There's no need to do this manually. But again, the huddle tip here is to check on, how did we manage no-shows yesterday? Do we have those fees charged within the system already? And do we have any cancellations that we need to fill for today? And also just letting the physicians know about those cancellations so that they can plan their day if there is a need to move things around. Huddle point number 6 is really talking about on-time performance. So it's looking at the schedule, it's looking at who's double booked already, it's looking for procedures that may run long, and where are potential bottlenecks today. Acknowledge them, have a backup plan, and really it's about that communication so that your nurses, your MAs, everybody's aware of what those potential bottlenecks are so that they're aware to be able to prevent any sort of slowdowns in the process. Point number 7 is going to be staffing and call outs. Always a fun, right? So are there any surprises? Who's called out today? How are we covering their critical responsibilities? Who are we communicating? Did we get a sick call, for example? Obviously, having a plan around coverage is really critical, and being able to figure out, okay, that sick person was normally the person who's doing eligibility, but they're not going to be able to today. So we're going to have to split that between these 2 individuals. And so having that conversation, again, this is first 15 minutes of the day, 7:30 to 7:45, 7:45 to 8. Don't have the staff all rushing in, starting the day, not prepared and on track with what the needs are for the practice that day. And last minute is point 8, which is any reminders, policy changes, updates that are critical for the day. This is not meant to be a weekly meeting where you're running through all of the policy changes or updates within your practice. This is the quick, hey, guys, remember that we had that change on telehealth billing. Just to make sure everyone's aware, we can now, schedule those visits. So this prevents mistakes before they happen, ensures everybody on the team has the most current information. Again, this should not be new information. Should be quick reminders of something that's critical for their day. So that's it. 8 points, 15 minutes, and really critical to have these quick touch points. Again, you can do these all as a quick huddle. You could do these by department, depending on how big you are. Really, really critical just to have this quick touch point, and also let folks provide any critical issues that they have so that you can resolve them as the leader, right? And so this could be the CEO, physician owner, or this could be the office manager who's running these. Just depends on the structure of your facility. If these 8 points work great for you, great, implement this right away. If you need some adjustments, this is really all about what are the critical elements that are happening today in my practice? How do I make sure that those don't have failure points? And if there are concerns over failure points, let's address those and work on a solution quickly so that we can have a successful day. So hopefully this helps just really kind of clear your head, get chaos under control, and run a practice on autopilot. All right, thanks so much. Have a great week.